second.
Okay.
All right, whenever you're ready.
The Board of Licensed Dietitian meeting is convening at 9:12 a.m. on October 19th, 2022 at the Health Licensing Office in Salem, Oregon by telephone conference call. I will now call roll. Yulia Bragdorf here. Jerry Yoker.
Here.
Bert Connell. Ross Kegel.
Here.
Sarah Love. Jessie Pavlinac. I saw Jessie here. I see her on the
Oh,
list.
I'm sorry, Eula. Yeah, Jessie Pavlinac is here.
Thank you, Jessie. Members, when you wish to speak, please state your last name for the record. Board members are asked not to use chat feature during the meeting. Public members wishing to speak must first sign in order on the roster when sheet available. For public members calling in on the public phone line, please email at April Fleming at April.Fleming at DHSOHA.state.or.US and provide your first and last name. Public and interested parties' feedback may be heard during the public interested parties' feedback period if indicated on the agenda. Everyone is asked to use appropriate language, manners, and protocols when conducting board business. This meeting is called to order.
I keep seeing your icon blink, Yulia. So if you're ready to do the approval of the agenda. You're muted if you're trying to talk, Yulia.
This is Bragdorf. Typically, the approval of agenda starts with whoever is running the meeting on the health licensing side. So let's first order of business agenda. Anybody would like to make a motion to approve the agenda?
Euchre, I approve.
Any second?
Pavlinac, I second.
The motion has been motioned and second. Anyone in favor? Call Bragdorf. Aye. Euchre?
Aye.
Connell? Absent. Kegel?
Aye.
Low absent. Pavlinac?
Aye.
The motion has been carried. Introduction. Jessie, welcome.
Hi, Yulia.
So great to see you again on the board. Very, very happy to have you. Would Health Licensing would like to make a couple comments about introducing Jessie to all of us, please.
Sure, thank you very much. This is Bob Bothwell. I'm the interim director here at Health Licensing. And Jessie, welcome. And we look forward to having you serve with us. Let me make one other thing. Julia, when we do roll call, the folks that are not here, you don't have to call them.
Okay.
Okay, thank you. And then Jessie, do you want to tell us a little bit about yourself, please? And then I'll have some of our staff that you may have interaction with introduce themselves.
Sure, and I'll put my camera on, even though I know I'm supposed to keep it off, but I feel like at least, hi, this is Jessie.
Hi.
Jessie Pavlinac. I'm a licensed dietitian and a registered dietitian nutritionist. I worked at Oregon Health and Science University for over 40 years as the clinical dietitian and a manager of clinical dietitians. Retired back in July of 2020, and I'm still an adjunct there. I also picked up a teaching gig at Clackamas Community College this last summer, so I do a little teaching. I've been involved with dietetics on a local, state, and national level, and continue to do so. And Yulia and I go back to policy, I don't know, 10 years, Yulia?
Probably even more. Yes.
Probably even more, yes.
Way back. And
way back.
Yeah, yes.
So thanks
Very
for
good.
having me.
Thank you. Like I said, I'm Bob Bothwell. I'm the Health Licensing Office. I've been here just about 11 years now, and have been the interim director for 5 months, going on 6 months. And I have 20 years of corrections prior to coming here and a few years of law enforcement prior to that. And I did a gig up at the Board of Nursing for almost a year when they were having some issues up there. Tina Russell.
Good morning, everybody. My name is Tina Russell. I'm the licensing manager. I've been in the office or at this office for 26 years, and I have worked throughout the office in various positions. Welcome, new board members.
And Jessie, I think you've had contact with Ann Thompson. She's here with me right now. And Derek Foles, do you have a camera?
Not currently set up.
Okay. So, but you've had contact with Derek. I was hoping he had a picture there, but he doesn't. And on the screen now is Trampus Shuck. Trampus.
Hello, I'm Trampus Shuck. I'm the interim regulatory operations division manager. I took over for Bob when he became the director. So I kind of am the person who you might deal with if there's anything has to do with regulatory. I've been with the office for about 14 years, and happy to meet all of you.
Okay. In the boardroom, we have April Fleming. You'll get emails and phone calls from her as time goes on. I can't tell if she has a camera back there or not. And then, so Yulia, whenever you're ready to move on to items for board action, we can do that.
Sounds good. Welcome, very welcome, Jessie. It's so wonderful to have you here. So our board action, we need to look at our dates for the next year, and also we need to look at the elections of chairs and vice chairs for the next year. So let's start, please, with the dates. Any feedback on the needs of the agency as to what our options are that work for you, since you support so many boards? And let's look at that first and then look at our availability.
Sure, Yulia, thank you very much. This is Bob Bothwell. So what we have currently is April 19th of 2023 at 9 a.m. and October 4 of 2023 at 9 a.m.
And what days of the week are those dates that you listed? This is Bragdorf. April 19th. I'm quickly searching.
Yeah, we try to keep them the same, but we're looking right now. That was a nice curveball. Okay.
It's Wednesday.
Yes,
Wednesday, 9 o'clock. Any discussion about these proposed dates on April 19th, which is Wednesday at 9 a.m., and October 4th, which is double checking what it is. Which is also Wednesday at 9 a.m. Any discussion, board members? If there is no discussion, would anyone like to make a motion to approve the dates of April 19th, 2023 and October 4th, 2023, both at 9 a.m.?
As Euchre, I approve.
Motion, thank you. Anyone to second the motion?
This is Pavlinac.
Cagle here. I approve.
Thank you. Motion has been made and second. I'm going to call roll call. Brogdorf, aye. Euchre.
Aye.
Kegel.
Here. Aye. Sorry.
Pavlinac.
Aye.
Thank you. The motion has been carried. Our dates are April 19th, 2023, and October 4th, 2023 at 9 a.m. Next item is going to be chair and vice chair. Discussion.
Hi, this is Bob Bothwell, the Health Licensing Office. So Julia is currently the chair. You're in your second full term. Your term expires April 20 of 2025. At this point, if the board members would like, and if you would like to remain the chair, it looks like you can. And then looks like, so Sarah, who's not here, she's in her first full term. She's good until October 17, 2023 for her first term. Jessie, also in her first term, is good, and that term ends June 29 of 26. And Dr. Euchre, he's in his first full term, which ends October 17 to 23, and he can reappoint. And then Russ, he's in his second full term, and that expires May 31 of 2025 and cannot reappoint.
Thank you so much for that information. Any discussion, any interest in being a chair or vice chair? I'm happy to continue serving, but if someone would like to be a chair or vice chair, a chair will be very happy to also give that opportunity to another member. Who is our current vice chair?
You have one?
No, our vice chair resigned.
Yeah, we do not have a vice chair.
So let's split it in two parts. If I'm happy to continue serving as the chair. Once again, if someone would like to be chair, please bring this to the vote. Otherwise, we can vote currently for chair, and then let's discuss who would be willing to volunteer to be vice chair. Anyone would like to make a motion about voting on a chair right now?
This is Pavlinac. I move that Julia remain as chair of the Oregon Board for Licensed Dietitians.
Any second?
Euchre, second.
Okay, let's call a vote. Roll call. Bragdorf, aye. Euchre?
Aye.
Kegel?
Aye.
Pavlinac?
Aye.
Thank you. The motion has been carried. I will remain a chair for another year. Let's please bring to discussion who would be open to serve as a vice chair for the next term, for the next year. Yeah. Kindly asking for volunteers to please step up.
Julia, if I may,
Please.
so everybody understands the duties of the vice chair. We provided you what the chair's duties are and the vice chair's duties. And basically, what Julia is doing right now, if she's unavailable and can't be here, then the vice chair would pick up the gavel, so to speak, and act as the chair in Julia's absence. And have no fear. Here at HLO, we are happy to walk you through every step of the way and until the vice chair is comfortable. So we're not going to leave you to try to flounder yourself through a board meeting. So have no fear. If you have an interest, please speak up, or if somebody would like to nominate somebody.
May I ask a question? This is Pavlinac.
Absolutely.
Have we reached out to the people that aren't on the call of their interest, or have they expressed interest?
I'm not aware of any interest from them, and neither's Anne or April.
Would someone like to put forward a nomination? The Mrs. Brogdorf, I would like to ask, so we currently have few of us here present, and some of you already served both as chairs and vice chairs in various capacities. From what I see, the terms are still here. We all will be here for the next year. So
Right.
do we want to invite Jessie to be the vice chair, fresh addition to our board? And I know Jessie served in a very instrumental roles of the board in the past.
This is Bob. Thank you, Yulia. It would totally be up to Jessie. She can nominate herself. And then we would get a second in the roll call. But unfortunately, I don't think in this case, Yulia, you can nominate her.
I'm just opening
Sure.
room for
Thank you.
discussion. Yes, I'm not nominator. Yes.
Kegel here. I'll do it as long as I can find out how to fix this team site.
Well, we'll get you in touch with Nathan, and we'll definitely happy to work with you, Russ, to ensure that you're able to access the meetings.
Thank you so much, Russ. Anyone would like to second Russ' nomination?
Euchre, second.
Thank you. Let's vote. Brogdorf, aye. Euchre,
Aye.
Kegel,
Aye.
Pavlinac.
Hi.
The motion has been carried. Welcome, Russ. Thank you for serving as a vice chair.
Thank you, Russ.
Uh-huh.
Our next item on the agenda, I'm passing it over to the agency. Bob, would you please take it from here on the reports?
Certainly, thank you. So the next slide that, if anybody, I assume everybody's following on the computer, is the licenses issued, and I bring it up here. I can tell you what slide we're on. We are on, yes, thank you. Slide 14. But prior to that, let me give you a quick update on some things happening here at the office. So currently, there's a Senate Bill 1549, which has to do with temporary staffing agencies. And in a nutshell, temporary staffing agencies are going to be required to register with HLO if they are doing business in Oregon. And so what that means is if their brick and mortar building is outside the boundaries of Oregon, New York, or any other state, and they're doing business, they're still required to register with HLO. And one of the reasons for that is, and I'm sure everybody's seen in the news and with you all working in the medical field have seen and heard about traveling medical professionals make quite a bit more money than someone who's stationed at any particular medical facility, hospital, nursing home, and what have you. And one of the things that this bill is hoping to accomplish is to rate cap how much hospitals and nursing homes and other medical facilities are paying these agencies with their traveling medical professionals. And one thing, there's not a whole lot to share at this point. The bill itself has required the health authority to contract with an outside group, and in this case, I believe it's the Mercer Group, and they are doing all the research as to how OHA, the health authority, and HLO can accomplish the tasks that are laid out in the bill. And the bill and this group is required in the bill to have a report to back to the legislature at the end of December this year. And then beyond that, the legislative group will get together and decide what changes may or may not need to be done to the bill moving forward. And that's all I have on Senate Bill 1549. Any questions on that?
How does it, how does it impact our licensees?
It may impact you in as much as if there are licensed dietitians that work for these traveling agencies, and it'll may cap what you can make as a traveling dietitian.
Thank you.
Any other questions on that? Okay, and then the other thing I had on the director's report was the introduction of myself and Trampus, but we've done that already in the introductions piece. So if nobody has any objection, I'll move on to slide 14 of my report, which is licenses issued. And in Q1 of this year, and these years are fiscal years, so from July 1 to this report was run in September of this year, but the quarter is July, August, September, October. So that's how these fiscal years operate with the state. They start in July and end June 30 of the following year. So currently in this quarter, we've issued 77 new licenses. And on slide 15, we have licenses renewed. And in the same quarter, we've renewed 240 licenses. And also you'll notice that we have the different colors in this bar chart, and the majority of your licensees are renewing online, which is a good thing. Next slide is license by age and gender. Obviously, it appears to be a predominantly female board licensure, and it looks like we have a relatively young licensing base. And we have one individual that carries a license who's between the age of 82 to 89. She's a female. The next slide is volume trends. So we're at 1,192, and the good thing is the trend continues to climb. And then on slide, go ahead, was that Russ?
Cagle here.
Yes, sir.
Okay, I'm going through the totals here. And the license renewed, you got 2186. And then you have by gender, 1154. And then you got 1192 on volume trends. I just don't understand the discrepancy there.
Okay, so those are averages, and the 2186 that was on the license renewed, that's
Yeah.
That's a total of 3 fiscal years.
Oh, okay. Yeah, I see that now. Okay.
So again, these are averages, and the reports were run in September. We don't run them here. We receive them from the health authority. We're working on trying to get a fiscal analyst here in the office, but when that'll happen, I'm not quite sure.
Does anybody have any indication of why the sudden increase in license?
Do you want me to handle that one?
Sure. Ann's here, Russ.
Okay.
Hi, Russ. It's Ann.
Hi, Ann.
Hi. It's my understanding that a lot of insurance companies and the dietitians that are listening, Jessie and Yulia, may disagree with me, but it's my experience that a lot of the insurance companies are putting greater efforts into preventative care, making sure people, if they eat right and they get the physical exercise that they need, that their long-term outcomes health-wise are going to be better. So we're seeing more and more dietitians who are doing telemedicine, who are doing diabetic care, who are kind of playing those kinds of preventative care roles on behalf of Kaiser and Providence and some other third-party reimbursers. Yulia or Jessie, do you have any additional information?
This is Bragdorf. I think yes, the coverage is expanding into inclusion of coverage for services of dietitians. So to be receiving reimbursement, dietitian needs to be licensed if they choose to use insurance.
Correct.
Yeah. And if you notice, the trend for Q1 is always higher than the others. And predominantly that's because new dietitians graduate from their programs in June, and then they have to be licensed. I mean, we're a voluntary licensure state, but all hospitals require licensures, and the number of dietitians, for example, OHSU has expanded tremendously for the reasons that were just discussed. Now with telehealth, they have a lot more business, and so they have to be licensed. But it's kind of the graduating class trend, and they start working too. That also increases that, in my opinion.
Okay. All right. Sounds good.
Okay, this is Bob again. So we're on slide 18, which is your financials, which are good. Again, this is a fiscal year, so it began in July 1 of 2022, and it's running current. So you have a high ending cash balance, and which is good. The revenues and expenditures are very close, and so we try to keep the numbers at a relatively decent level in the event that we have a huge case or something comes up where it costs the board money to resolve a administrative hearing or any other issues that may come up. And some of those costs can go up really fast. In the bottom of that page on slide 18 is your fiscals, and you may wonder why it looks different than previous board meetings. They are not including the previous bienniums like they used to right now. So your shared assessment is 1.568%, and your small board share of is 9%, 9.782%. And we don't inspect any of your workplaces or facilities, and we don't provide an examination out of this office. So that's why those are not applicable numbers. Any questions that I can answer or try to answer? Okay. Yulia, if you want us to continue on, we can get Trampus on the line here and he can give you his regulatory report.
Yes, please.
Thank you.
Well, hello, everyone. This is Trampus again. Here to kind of go over this regulatory report. It's fairly self-explanatory, but you can see that there's 3 biennium on this report. At the top section with open cases, you can see that we have 2 open cases for the 2023 biennium, and those 2 are just currently being investigated at the moment. they are both like a service type concern. So, and then you can see on the bottom part of that table, you can see that the cases that were opened and then closed, and the grand total of the cases at the bottom. So, was there any questions about this report, or?
Bragdorf, oftentimes we see the cases open when they're issued with continuing education. Are these continuing education related cases?
These are not. Both of these are actually complaints, outside complaints.
Thank you.
Okay.
Yeah.
Well, if there's no other
Thank
questions.
you so much.
No
Yes.
problem.
Policy?
Can move into policy, and I will turn it over to Ann.
Hello again, everybody. For the record, this is Ann Thompson, your policy analyst. I have a couple of pieces for you. If we can get in the Wayback Machine, I talked about this with Jessie, so she will be right on target with us. A couple of years ago, we were working on an administrative rule regarding continuing education, and it's very much the policy of the office to do a matching continuing education with a license. They have a 1-year license, 1-year continuing education cycle. Well, we got a lot of feedback from the licensees that they really cherish this concept of a rollover, because they go and they get their national certification, they get a pile of continuing education for that, and they wanted to be able to have like a bank that they could then spend forward. And that was unusual for us. And so we talked to our DOJ experts, and they said it was within our authority to allow the rollover. So what we wanted to do was we looked at the rule that the rollover was in, and we wanted to make sure that all the little pieces matched, all right? So we made a slight change in the documentation retention period, saying, okay, you can continue to roll these credits forward, but if you get audited, we wanted to make sure you were keeping the documentation you needed for the same amount of time. I also had a conversation with licensing manager Tina Russell, and we were thinking we have 3 stages that a license can be in. You're active, and that you're current, everything's paid, it's great. Inactive, which means that you've missed your renewal date, you're late. And then we have expired. After 3 years of being late, you become expired, and if you want to have a license, you need to reapply and pay all the fees and meet the requirements at the time. So we looked at those 3 stages and we said, okay, if you don't renew your license on time, but you've got this continuing education bank that's kind of ticking and active in the background, how can you use that bank? Can you bring your license current if you're late and have those credits, when you attest that you've been keeping up with your continuing education, make sure that those credits are they're ticking in the background so you can use them if you decide to become current. So we just wanted to make sure all those little pieces correctly match the rollover. So we made a slight adjustment to our rule on the active, inactive, expired piece and the document retention period. Does that make sense to everybody?
Yes, thank you so much, Ann.
Oh, of course. And continuing education, there seems to be, and I talked with Jessie about this in our orientation on Monday, there's a lot of confusion in this particular profession about continuing education. Part of it might be that licenses are renewed by places of work, but the requirements of the national organization, the requirements of the state tend to be a point of confusion. Even Jessie said that some of her fellow professionals were confused. So after we talked about this at our spring meeting, I sent out the communication. It's in your packet, dated April 21st. And it talked about what your requirements are as a licensee. Because in addition to what HLO needs and what the national requirements are, you've now got this little continuing education piece on cultural competency. that was introduced to the license in 2019. It's a 1 hour requirement every other time you renew. And the education has to be acquired. We encourage you to go to the Office of Equity and Inclusion and take one of their approved classes, because it's just keeps it simple. In a complicated ecosystem, that's the simplest thing to do, is to get your cultural competency through them. So now you have these 3 things that the licensees are tracking. So I sent out a little, let's get it all straight thing in the spring, and I didn't hear anything back. Usually if people are confused or what does this all mean, I'll get some almost instantaneous communication from the licensees that are like, okay, what do we do? And I didn't get any of those. So I'm thinking, okay, great. Maybe folks are kind of starting to get it all straight in their minds. So are there any other questions or concerns?
Bragdorf, I have a question. So the cultural competencies thing, there's, for those who do not want, who get like a lot of cultural competency credits from other sources, what are the metrics to know that that's going to be acceptable to the board?
Yeah, that's a tough one. Senate Bill 2011, no, it was a House bill, my bad. And I mean, we'll get in the Wayback Machine again. A few years ago, remember we brought forth the idea that boards could require, if they chose to, add cultural competency to their continuing education requirements. And at the time, the board looked at it and said, well, it's not the idea of it that we have a problem with. The bill sent people getting this education to courses that were approved by the Office of Equity and Inclusion. And at the time, there were like 2 classes approved. And so the board was like, listen, we're getting a lot of this cultural competency stuff, you know, at the CDR, at the national level, we're good. Well, the legislators, along with the other, I think, 11 boards that were mentioned in that bill, came back in 2019 and said, you know, we're not real happy with the number of boards who have chosen to add this. So now we're going to make it mandatory. And part of the mandate is that you need to go through the Office of Equity and Inclusion and choose something that they've approved. They have it's like a grid, and it says, okay, here's all the people who offer the courses. We've approved them. They meet our requirements. And here are the professions that would fit for that course. Like this would be good for chiropractors, and this one would be good for medical doctors. They also say in the bill, or courses that meet the skills requirements outlined by the Office of Equity, Inclusion, and Rule. They haven't done a real good job with that. So to be conservative, we're telling anyone who calls, just go ahead and get your education through the Office of Equity and Inclusion. The way those courses are offered is the trainers themselves reach out to the office, say, this is what we offer, this is what it involves. They vet the course, and if they approve it, then they put it on the grid, the matrix of available education.
So what Bragdorf again, so what I'm hearing that the licensee does not have a choice, and they're exclusively required to get this hour math through this particular grid. And we as a board also do not have a choice to lose the licensees to get this course, because for dietitians, we need ethics and cultural and all of this. We cannot get these classes done anywhere except here. And that's not, we didn't have a big room. I also see Jessie has a question, so I want to step back, and after Ann answers, maybe Jessie can speak up.
Sure. The bill, House Bill 2011, that mandated this was very clear. Remember, we talked about when we have orientation, and I talked to Jessie about it. We are the executive branch. We have to follow what the legislature requires. And they not only said what you had to get, but it said in the bill where you had to get it. And like I said, there's a little line in there that says, or that meets the skills requirement outlined by the Office of Equity Inclusion in rule. And the reason we're kind of pointing people to just go and take one of the classes there that they approve is they haven't done what I consider a really clear definition of what those skills requirements are. And the office is still working on it because we understand that this is a complication for a lot of our licensees. And we try to make things as simple and clear as we can. And so we've been working with our DOJ attorneys and all, like, how can we kind of drill down more on this or meets the skills requirement? And we're not there yet. And so we always try to guide our licensees into the clear, stay out of the gray, make it as easy for yourself as you can. And so right now, that 1 hour every other time you renew, the safest thing to do is to just pick something off their list. Does that help, Yulia?
Yes, thank you so much. I just want to make sure that people who hear this meeting have very clear answers. So thank you. For now, I'm here, and we really just need to go for all intents and purposes. We have an option to go outside, but the rules and regulations for what meets criteria are not outlined. Therefore, we need to go by this grid. A question, I know Jessie has a hand out. Can we as a board request clarification to get this outline so we can pose it to our licensees so they do have a choice to meet this criteria elsewhere?
Well, what we're doing is, and it's not just your board, it's respiratory therapists, it's the long-term care administrators board, which has both residential care and nursing home administrators. And on all of our licensees that are affected by this behalf, we have been working with the Office of Equity Inclusion. We have been trying to reach out to other boards like the medical board and the board of nursing that are also on this list and kind of asking them, where are the rub points for you? And we have been we're working behind the scenes on your behalf, and we're trying to smooth it out. And we're trying to figure out how often are these classes approved so that it's current. Is there something else that they can do to make their matrix, the way they approve classes, a little more clear? Just right off the top of my head, I know we looked at their criteria, and it was a very detailed, long document. It wasn't like, if we said continuing education has to address dietetic principles in these 3 areas. No, it was complicated. And when we looked at that enormous matrix, we were like, we don't want to say, yes, go ahead and take your course from CDR or from whomever, and then have you get caught in an audit and say, well, you didn't meet item 54B of this extensive matrix, because we were trying to figure it out. And so we're still working on it behind the scenes, but we haven't really gotten the kind of clarity that I would feel comfortable saying, yeah, go ahead and take this class as long as it has X, Y, and Z, you're fine. Because we try to be very conservative with our licensees and guide them in an appropriate way. And so right now we're just saying, just go through the Office of Equity Inclusion. It's the cleanest way. If that answers your question, I know you've had, of course, Jessie, you've had your hand up for a long time. Thank you.
Oh, Pavlinac. I did learn from yesterday, Ann, or Monday. I guess I have like a 3-part question.
Sure.
One, does the renewal of the license specifically, it's every other year, say you have to do that course this year so that people don't have to keep track of it?
Okay, part 1, licenses are annual.
Right, and so
licenses,
every other year, does it say your equity bias, whatever training it is due this year?
You have to have it every other time you renew.
Sure, so but how does a licensee keep track of that?
And there's the other thing. It's really up to the licensee to keep track of what their requirements are. When this first came out back in 2019, we try to do things very quickly because we pride ourselves on our efficiency, right? And so we thought it would be simpler why don't we just require it every year? And that way they don't have to say, did I do it this year? Was it last year? I don't know. So we actually passed that with one of our boards, the long-term care board. And then our attorneys looked at it and spent a little bit more time. And you know how you read something on first blush and you think you got it all figured out, and then you spend a little bit more time with it, and then you go, oh, wait a minute. Our attorneys spent a little bit more time with that bill, and they realized that we did not, in fact, have the authority to require it every year, which would have made it simpler for licensees, right? So a lot of our boards that were kind of on the tail end of the rulemaking process, they got the every other year right off the bat. So long-term licensed dietitians was one of them. Long-term care, I just had to go back and go through rulemaking again to change their every year to every other year. So again, you know, with Jessie, we talked about in board member orientation, you can, you know, the law says you can make a dog, it can look like anything, but you can't have a cat. This is one of those cat dog situations. What would be simple is not necessarily what we're supposed to do. And so licensees have to keep track of that themselves.
So it's not possible in 22 that there's a notice that goes out with them, and in 24 there's a notice that goes out, etc.
Well, because licensees, that's a great question. That would make perfect sense if licensees all re-upped at the same time.
Well, they have to re-up during the calendar year. It's not the same time, but it's the same year.
But if, you know, everybody's every other year is different. Depending on when you started, depending on when this requirement went in, everybody is kind of individual on what their licensure year is, because it's the licensure year is good 1 year from the last day of the month of issuance. And so somebody's year might be in October through the end of September. So it's the idea of notices. I mean, our notices go out for renewals, but that's a courtesy. Per our statutes, folks are responsible for keeping track of their licenses, their renewals, and their requirements.
Okay, next question. Have we audited anybody, and how are they really doing it? I mean, I know, and my last question is what I was told, that all the ones who the diversity, the office you said, was like $40 to take a class. There was an additional charge. And at least when I was a manager of 50 dietitians, that's a hardship, and we weren't paying for that. Whereas the academy, CDR, et cetera, has done a lot of that for a minimal amount of money. So people may not have said anything, but they're not happy about the extra charge from having to do it in that particular manner.
I understand. And when this first came about, one of my questions was, what are the costs associated with these courses? And the exact phrase I got from them was, leadership is not considering cost when they approve or not approve a course. That is not a concern of theirs. So I understand, but again, we all have to abide by what the law says, and that puts us there.
This is Bragdorf. I think I'm looking at this matrix right now. There is one non-cost item from Oregon Health Authority. It lists all kinds of people, even massage therapists and doctors, all in one clunk. Dietitians are absent from this list. This is one non-charge course for firearm safety and suicide prevention. I think it would we be able to take this kind of course even though dietitians are not listed here, or just because dietitians are not listed, we are exempt from benefiting from taking this free charge of course? My other point is, can we as a board to make a recommendation to make at least 3 courses available for our licensees free of charge, and if they cannot approve through outside vendor, make it be responsibility of the agency to provide us with a free of charge course as a social justice issue, because some people and compensations of dietitians are not as high to be adding such a significant financial burden.
Yes, I hear you and I understand. What would be the mechanism for getting a course at? If you know of an association or an education opportunity or even CDR, if they have a course that would benefit your dietitians, that would, that addresses cultural competency, and they want to approach, what they could do is approach because it would not be the board's purview. It would be something like an association or a trainer or a college, community college. They can approach the Office of Equity and Inclusion on their website. They have forms and the application process, and that training would go through their screening. And if it's free of charge, that's great. And if it meets the requirements and they approve it, then it will be posted and be available. That's kind of the process of how they're handling adding courses to the matrix.
Thank you. And I'm asking something slightly different here. On the matrix on page 3 in the bottom, addressing firearm safety with patients at risk of suicide. Dietitians are omitted from the list of suggested providers. Would dietitian be able to take this free of charge course? And it can account for their cultural competency. I'm looking at the matrix of
Sure.
CCCE registry.
Right. And I haven't forgotten about your other question, Jessie. I've got a pin in that. If it does not say that that course has been approved for your profession, then it really is not something that we would recommend. We recommend them taking a course that has been approved specifically for their profession. To Jessie's question, we do periodic audits, and we select usually 10% of the license base, and we just randomly contact them and say, okay, we need your documentation. The last time dietitians were done not too long ago, but I don't believe that this requirement was in effect the last time we did audit. We found the largest issue. I want to say there was 11 or 13 people who got caught in the audit. The confusion between the CDR and the state requirements seemed to be the snag that affected most people. But this was not in effect the last time we did an audit. We have over 30 professions, 16 boards and programs, and our continuing education specialist, Callie Zink, has been inundated with all kinds of new requirements. And I don't think that, I'm trying to think the next time they'd come up, I'd have to check with her the next time dietitians are going to come up on audit, and we'll learn more about this requirement then.
Sorry, Ann, this is Pavlinac again. I just think if we aren't notifying them when they have to take it, you're going to find a lot of people, and I'm trying to figure out if I did it, because I expected it to be on my renewal notice. And so this is, I think it's going to be a real problem, because I think people won't remember every other year. I may be wrong, and I'm certainly new to this board, but it seems like we should be able to help people with that, or I don't know.
I
maybe not our role.
No, I understand. I mean, it's twofold. We want to be helpful, but we also have to hold people accountable. If this is how they make their living, and their license is their lifeline, the idea of keeping track of it seems to be part of professional standards. And I know people struggle, but it's kind of, it's how you make your living. And we try to be as helpful as we can. Again, we sent out communications. I get a lot of phone calls, what about this? What do I do with that? And we are always happy to pick up the phone and help an individual in any way we can. We send out, I'm sure anybody who's been on this board long enough knows, I've sent out multiple communications about requirements, keeping track of your CEs. I mean, again, the whole rulemaking process, when we did the rollover was not something that the office generally does, because again, we want to match the license to the CEs, but that was something that was passionate to the license base. So we sought legal advice, and we found out that we could do the rollover. Tracking CEs and auditing with a rollover is extremely complicated for the office, but we made an extra step. So I feel pretty confident that we help in every way that we can, But folks also have to take ownership of their licenses and keep track of their requirements. I mean, it's just part of having a license.
Thank you so much, and thank you so much for trying to help and explain and involve us in all of these processes that are unfolding in front of us as they're unfolding. Thank you so much.
Oh, of course.
Thank you. My feedback to and I don't know, maybe you have a suggestion what to do with this feedback, because I can voice it here, but it just gets voiced here and that's about it. But what are the steps to bring up to people who do make decisions about what goes on these on this matrix, to perhaps ask Oregon Health Authority to create and offer 2 or 3 free of charge options for the purpose of the equity and inclusion and just truly social justice, because like other professions have that option from Oregon Health Authority, and dietitians are excluded from benefit of the free Oregon Health Authority offered classes to meet this requirement. So I'm asking, how do we call upon Oregon Health Authority to provide us with a class we can take to meet this requirement?
Okay, all great questions. Well, first of all, you can't call them and say, I represent the Board of Dietitians. That would be inappropriate.
Of course.
What you could do is, just as an individual, you could reach out to the Office of Equity and Inclusion, not as a board member, but with your dietitian hat on, and say, there's really nothing here that's available for dietitians that's free of charge. Could you take a look? Because the way that the system works, the trainers or the people that are offering the courses approach the Office of Equity and Inclusion. And when the Office of Equity and Inclusion says, well, who would benefit from this class? They might tick off 5 or 6 professions, but maybe it would benefit dietitians, but it's up to the person offering the training or the company or whomever to tell the Office of Equity and Inclusion, the following professions would benefit from this. And if they like the course, they go, okay, great. And they list those professions. If you as a dietitian approach them, take a look at the training and say, this would greatly benefit dietitians and it's free of charge. Could you take a look at this and see if you could add dietitians to the list? There's often many doors into the same house. As long as you are not acting as a board member, that's certainly something you can ask about. Because this is, we're all part of the giant Oregon Health Authority universe, right? We're like a little satellite, and Office of Equity and Inclusion is a little satellite. So much so, they have very few staff, right? So I don't think they're spending a lot of time going through and saying, well, maybe this would be good for chiropractors, or maybe this would be good for, somebody else. I don't think that they really have the bandwidth for something like that. So they sort of take the information they're given and they list it. If you want to contact them as an individual and say, could you take a look at this class and see if dietitians could benefit? They may do that. They might say, hey, we'll consider that, or here's the steps. I'm just not aware of what those steps would be. But as a private citizen and a professional, you're certainly, there's no reason why you can't call them up and say, hey, can you add us to these 3 classes or whatever that are free of charge?
Thank you so much, Jen. I really appreciate it. This is
of course. And also you can check with your associations, Oregon Academy of Dietetics, if they've got a course that you guys think is just awesome and covers the nut and is inexpensive, you can certainly, as a dietitian, a member of that association, not as a member of the board, approach them and say, hey, can you contact Office of Equity and Inclusion, fill out whatever forms they have and get this class offered, because it's terrific, it's inexpensive, and it would ease the burden on licensees to have something that's available, accessible, inexpensive. That's certainly something you can do too. So there are a couple of mechanisms there for you. Is everybody else awake? Are we good?
I can ask one question. This is Bragdorf.
Of course.
Just for clarification, so according to the bill, the law wise, the training must be approved by CCCE, right? We cannot look at this as a board ourselves. We cannot look, I just found a document about domain 1, 2, and 3. We cannot look at their domain of cultural competency identification of what considers to be fitting criteria but not fitting criteria, and pass a judgment as to we think this particular class fits this particular criteria. Is that correct?
Yeah.
Mhm.
Yeah. Again, we're trying to drill down, and we were hoping that when they finish their rulemaking, and again, they're a very small office, they don't have the resources we have, that when they finish their rulemaking, which took a long time, that they would very clearly outline in rule the skills requirement that a course would have to meet in order to meet this requirement outside something that they've themselves handled. And when we saw the rulemaking, we were not confident that that would be that would keep our licensees in the black and white. It was their criteria and their matrices are very complicated. And I thought, and the other policy analysts here, we've looked at it, we've talked to our attorneys, and we said, how can we make this simpler? Is there a way that we can come at this from our rules and have our boards say, okay, you know, as long as the course meets these criteria, you can get it from anyone, you know? And we looked at it and just didn't have a degree of confidence to take that option. And we're hoping that with time, they're going to make things a little simpler. But the document that they had for deciding if a course met all of the things that they were considering was enormous. And the idea that somebody would sit down and go, okay, I'm going to sit with my class and see if it checks off the following 300 items. That just didn't seem user friendly to us. So we're saying until we can kind of be a little bit more confident with what they have in rule, just go take something from them. It's just the safest thing to do. Is this helpful?
Thank you, Anne. Thank you. Oh, yes. Thank you so much. Bragdorf, I'm done.
Absolutely. Anybody else? Okay. Well, if we're good, then we can jump out. I'll hand everything back over to Director Bothwell, and I see if we have anybody on the phone.
Yeah, this is Bob. Sorry, the public phone hung up on us because there's nobody on the line during the entire duration, hour and 15 minutes of the board meeting. So we're gonna dial back in and see if there's anybody there. Let's take a second or two. But I would like to circle back to one of Jesse's questions of, you know, notifying licensees that they're, and reminding them of their requirement with the cultural competency. We can explore here in the office, putting something on our website for a reminder, but again, it'd be up to them to take a look at the website. The other thing is since a lot of your constituents renew online, I don't know, but we can explore having something on that screen when they log on to renew, reminding them again, if you haven't taken it, you need to take it. And it is the cultural competency that I'm speaking of.
Bob, this is Pavlinac again. Thank you for
Yes.
that. I mean, the survey you have to take annually, and that's front and center. So it would be helpful to have maybe a reminder there. I'm just thinking about all the people that as a manager, we did pay for the license. We did the renewal with the employee and I right there. But they'd forget to do the survey.
I know.
Oh God.
When it first started, So yeah, we will do what we can. Like Ann said, you know, our interest is making life as easy as possible for licensees and as clear as possible, so we don't have issues. But sometimes things are out of our control. So yeah, we will explore that. And we're back online with the public phone. There's nobody there, so we can bypass public and interested parties' feedback.
Okay,
So-
thank you.
Yep. And what we
Do
have
we
left?
have any other business? I hear silence. I think we're gonna move to the close then.
Yes, ma'am.
The Board of Licensed Dietitians meeting is adjourned at 10:18 a.m.
Okay. Well, thank you, everybody.
2023.
Thanks,